You can always almost tell when spring football season comes in because the kids start coming in. And the reason why they're coming in because they usually do too many squats or lunges or deadlifts. So the kids know that. Most of the parents maybe not have an idea of what they're doing in weight training, but just from that repetitive motion or too much weights, maxing out the weights in the weight room really triggers those facet joints. The cheerleaders have the same problem. As they hyperextend their back, it engages those facet joints, and they also have back pain as well. A lot of the volleyball kids get it a lot too. I've treated a lot of volleyball kids and a lot of gymnasts. And sometimes they can even break their back, have a little pars fracture, where this little bone here didn't heal to that one. It's very, very common in gymnasts and also cheerleaders and also volleyball players. But the lineman football players, they're the ones that usually get it the most because they're maxing on too much weight and really triggers those facet joints. It's usually the base and the cheerleaders. They're the ones that usually get it more than the flyers. There's a few schools right here in Plano that you can just tell where they came from, what school, because there always a lot of work on the base. So usually the base girls have the most of the problems because that's where all the load goes. When they're catching the other kids, it goes right down to the facet joint. So the base and the cheerleaders, they're more prone to come here than the flyers are. You can't get better in a day, so it takes time, and sometimes you have to modify your activity. You have to take a few days off and really try to not hyperextend your back. And I always encourage patients to get your quads strong as you can, your hamstrings strong. That will help alleviate some of the pressure that goes to those facet joints and to your lower back.